Welcome, everyone. Connect with the campaign for grade level reading on social media. On Facebook, like the page Campaign for GLR. On Twitter, follow us at Reading by Third. And on LinkedIn, follow us at Campaign for GLR. Please use the hashtag Learning Tuesdays and tag us to tweet anything you learned from today's webinar, and we'll be sure to retweet. We encourage you to share your questions, reflections, and observations on social media. And once again, welcome everyone. My name is Sierra Sanchez, and I'll be behind the scenes helping to produce this conversation. I would like to take a moment before we begin to acknowledge our enterprise and programmatic funders, as well as our individual donors. Your support not only allows us to hold these vital conversations, but it also helps us to create meaningful opportunities to share insights, foster connections, and build the CGLR community. Thank you. And as we get started, I have just a few housekeeping details to share with you. First, we would love for you to introduce yourself. So please use the chat box at the bottom of the screen to share your name, city or state, and your organization. Be sure to select everyone so that we all know who is here, and feel free to share your thoughts and insights throughout the duration of the webinar. All attendees are in listen-only mode, but we encourage your engagement both through the chat box and by posting questions in the Q&A box. We will dedicate the last portion of the webinar to respond live to the questions you post, and our panelists will be typing out responses to all of those questions throughout the conversation. The webinar is being recorded and live streamed on Facebook. A link to the recording, as well as any slides, bios, and resources mentioned, will be shared in a follow-up email to all who registered. And lastly, we'll be having a brief on-screen evaluation during Q&A and highly encourage you to respond. This helps us with our commitment to continuous improvement. And before we start, I just wanted to call your attention to some of our upcoming learning and engagement opportunities. Next week on December 3rd, we'll be kicking off the month with a session co-sponsored by Learning Heroes and Attendance Works for a conversation that focuses on the importance of bringing schools and families together to get students back into the attendance habit. And then the following week on December 10th, we'll have an exciting doubleheader. A Crucible of Practice Salon at 12:30 Eastern Time with an interactive session featuring our GLR community in Indian River County, Florida, discussing their intersection of progress and practice. At 3 p.m. that same day, we invite you to come and learn stories and insights that highlight effective practices, resilience in the face of setbacks, and emerging opportunities to fuel student growth in the oncoming quest to recover learning post-pandemic. And the following week on December 17th, we will have a revealing and important discussion of the ways in which private equity and other profit-seeking entities are investing in childcare and the guardrails needed to ensure families continue to have access, affordability, and quality. We'll be sure to add a link in the chat box for more information and registration for those upcoming learning and engagement opportunities, and we hope you'll join us. And joining you now is Emily Samos, Senior Consultant with the Campaign for Grade Level Reading. Thank you and enjoy.
Thank you, Sierra, and welcome to each and every one of you. And thank you so much for joining our special session today titled The Daycare Myth Part 2, Creating Better State Systems for Children. And I am going to post in the chat right now. I can do two things at once, I think. Let's see if I can keep talking. Here is a link to part 1. So today's session is part 2. Okay. And many of you, I think many of you on this call joined our session in early October that focused on Dan Wuori's new book, The Daycare Myth, What We Get Wrong About Early Care Education and What We Should Do About It. That discussion sparked so much energy and interest in what we can do. That is, how to develop models and structures for delivering quality education and care to support parents, children, and educators. Those of you who were there expressed a desire to learn more about the ways in which states and communities are taking action to address what we get wrong and work toward actually getting it right. We left that webinar knowing that we would need to host a follow-up session to go deeper. So today is that day when we do just that. We will go deeper with state and local leaders who are creating promising systems that address the long-standing problems of cost, quality, workforce development, and retention in early learning systems. And I will point out 2 comments from our feedback poll really stood out to us from last time. And those comments were, first, how can I be an activist on these issues at the local level? And two, why what we all know needs to happen isn't happening? Are we not vocal enough? And I just want to point out, see how closely we look at those feedback polls. So please take a minute and complete the feedback poll at the end of the session today, because we really take your comments to heart. And these comments really prompted us to have this follow-up session. So to address those points and more, we will learn today about what states and local leaders are doing to drive systems change. And we'll focus on the principles for creating change that lasts. So drawing on your expertise as well, of course, the expertise of our panelists. And so we are extremely lucky to have Ellen Galinsky returning as our moderator for part 2 today. She's president of Families and Work Institute and the elected president of the Work and Family Researchers Network. You probably know some of her books, including Mine in the Making, and then what just came out, The Breakthrough Years, and then as well as her Substack titled Research to Thrive By. And now I'm honored to welcome and briefly introduce our esteemed panelists who are with us today in alphabetical order. We've already posted their full bios linked in the chat, so I'm just doing a quick preview of who we have. Berna Artis is president of the District of Columbia Association for the Education of Young Children, and she has a strong passion to support and advocate for diversity and equity in education. Angela Garcia is CEO and owner in La Cruces, Mexico. I hope I'm saying that right. New Mexico. Her mother founded Toy Box in 2001, and she took it over in 2010, and it is her passion to advocate for the children and families in the state of New Mexico. Chris Jones is the former North Dakota HHS Commissioner, where he led the integration of the state's Departments of Human Services and Health under Governor Doug Burgum's leadership. Then we also have Martha Strickland, who is the state director of 4K South Carolina First Steps. So next slide, please. And has over 35 years of experience in early childhood education. And she's most gratified by her current work to deliver the combined mixed delivery system of full-day 4-year-old kindergarten. We'll hear more about that. And again, we are very excited to welcome back Dan Wuori, author of the book, The Daycare Myth, What We Get Wrong About Early Care and Education and What We Should Do About It. And he is also founder and president of the Early Childhood Policy Solutions, LLC. So welcome to all of you. We look forward to engaging with and learning from you. And now I'm excited to turn it over to Ellen to get the conversation going. Take it away, Ellen.
Thank you so much, Emily. It's a joy to be back with you. I responded so much to all of the energy on the chat that I started writing right away. Can't we keep this conversation going? Because you all ask us to do two things, to go deeper into what states and communities are doing to get things right after Dan has told us both what we got wrong and what we could get right. And then also to talk about how do you create change that sticks. So that's what we're going to do. Now, I have, I see all the applause for Dan that is coming up. So thank you all, Dan. It's such a joy to welcome you back with us. You wrote a beautiful, succinct book, so clear, so powerful, and so persuasive. So you, in just a few minutes, and look at the love you're getting and celebration. Take us back, just for those people who didn't get to hear the first session, although it is posted on their website. So maybe you all could put a link to that in the chat now too, for people who missed it. But Dan, first let's just start with a brief summary of what we get wrong and then what we could get right.
Absolutely. Well, Ellen, thank you for helping to pull this meeting together. I've always wanted a sequel. This is very flattering that we're able to do this, and so I'm grateful to you and to the campaign, and also very much to the panelists that are going to be with us today. These are 4 very dear friends and 4 of the very smartest people, I think, in this field. So I'm really excited, primarily to hear from them today. As Ellen mentioned, if you want to hear more about the book, I think the first portion of this conversation that we broadcast back in October, or you can check out any of a number of podcasts or other recording where I go on and on at length about this book, The Daycare Myth. there are lots of resources to hear from me. And so today, I think, is really to hear from the states. But I'll give you just sort of a quick synopsis of the book, maybe for those of you who weren't able to join us last time. So the book is really about, in my mind, the disconnect between what we know from the science of early development and how that knowledge is played out, or sadly, in many cases, not very well played out in our public policy across the nation. The title, The Daycare Myth, it gets to what I consider really the crux of maybe the issue for our early childhood systems, which is to say that we hear a lot about various different crises in the field of early childhood, right? That we have an access crisis, and we have an affordability crisis, and we have a workforce compensation crisis, but that fundamentally, I believe that these are all symptoms of a larger crisis, which is just a crisis of understanding, right? That for the better part of 100 years, we have envisioned daycare, or more recently, the terminology has sort of updated more toward childcare, but that we have envisioned that as this sort of safe, warm place where children can be kept for 8 hours while their parents go to work, that it is primarily a workforce support for adults, more than it is maybe an environment in which to optimize the early development of young children. We know that that's the wrong approach, right? That when we think about young children needing primarily sort of supervisory care, but that older children get involved in deep forms of learning, we have decades of research at this point that contradicts that very idea. We know not only that children are learning from day one, but increasingly understanding the ways that they are learning even in utero. And so, invite you to pick up the book and learn a little bit more about that. The beginning of the book, though, is focused on what I call in the book the three simple truths of early development. Those are that learning begins in utero and never stops. The period from prenatal to 3 is a uniquely consequential window in human development during which the fundamental architecture of the brain is wired. And the third of those truths is that the way to optimize that early brain development is through highly engaged relationships with nurturing adults, right? And so the book sort of poses the question around, what if our system were better aligned with what we know about the science of early development? There are lots of things that I think, Ellen, by happenstance, I certainly don't think intentionally we are getting all of these things wrong. But, in many cases, we have policies in place that are actively undermining maybe the success of children and families and of early childhood service providers across the country. So the book sort of sketches out the case, the bipartisan case, very much for investment in young children and families, uplifts the return on investment and the benefit, not only to children and families, but broadly to taxpayers around these investments, and then really gets into toward the latter portion of the book, 2 different chapters that sort of look at maybe 2 sides of the same coin. So there is a chapter that looks at things that are happening in state and federal policy where we have gone astray and maybe need to make some correction in the way that we're approaching these questions. And then the final chapter of the book really looks at some proactive solutions that are happening in the states. And so it calls for not only a transformative investment in children and families, but also identifies what I consider some low-hanging fruit in terms of ways that we can make an immediate impact. And that really is very much, I think, the topic of our conversation today with the state leaders.
Before we go to them, I'd like to ask you some quick thoughts about, it used to be called the three-legged school: cost, quality, and workforce, and now we have workforce retention added to that. So what do you see quickly in some good solutions to that four-legged stool?
Well, you're right that we know, for example, that in the part of our early childhood ecosystem that we call childcare now, we know that it is unaffordable for parents, right? That parents are paying more particularly for infant care, than they're paying for in-state college tuition, than they're paying for their housing. We know that providers, meanwhile, you would think that as expensive a service as this is, that providers would just be raking in money hand over fist, but this is such a labor-intensive field and such a costly service to provide. We know that providers are barely keeping their doors open in many cases. And we know that the whole thing is sort of balanced on the backs of an entirely or almost entirely female workforce. In many states, that's a majority women of color comprising that workforce. And so we've got to do better all the way around. I think my response to sort of how we address those problems, Ellen, in part is going to be revealed as we talk with the states, because I can tell you quickly why I thought maybe of these panelists in particular to come and join us. I think one of the great lessons in the book and in my policy work across the nation is that this is not a partisan issue. In fact, that there are states, both the sort of the reddest of the red and the bluest of the blue, that are leading on this topic. And so really excited to be able to highlight a couple of states that maybe aren't always considered the usual suspects in terms of their leadership, but that are very much involved in leading the nation on this topic. Chris Jones is the former director of the North Dakota Department of Health and Human Services, and has recently sort of led and overseen a transformative new investment in childcare access in North Dakota. My former colleague, Martha Strickland, directs what I consider with some level of pride. Full disclosure, I was involved years ago in helping to create South Carolina's mixed delivery pre-K system, but I hold it up in the book as really a model for the country in terms of its unique structure and its the opportunity that it provides to really meaningfully engage private sector and community-based and faith-based providers in the delivery of this state-funded service. So we've got two, bright red states, and then, in terms of the policy solutions that we need to be looking at as well, compensation certainly is right at the top of the list. A lot of our access challenges right now are being compounded by the fact that we have an early childhood workforce in this country that is, according to the latest data we have available from the U.S. Bureau of Labor Statistics, making 59 cents an hour less than dog walkers. To help to co-construct the brains of young children. It's a shameful statistic. And so one of the places that is maybe leading the most in this space is the District of Columbia. And so we're excited to have Berna Artis with us today. DC, you may know, has created what they call their Pay Equity Fund, which is helping to provide salary bonuses for teachers in the district of up to $14,000 a year, bringing them much closer toward parity with their public school counterparts. And then Angela Garcia is a phenomenal child care owner and director from Las Cruces, New Mexico. You may know that, in November of 2022, Ellen, the voters in New Mexico went to the ballot box and voted overwhelmingly across partisan lines to modify the state constitution and enshrine a right to guarantee early childhood funding that has been really transformative for the state, that has allowed New Mexico to vastly expand its service offerings to young children and families. And so Angela is able to tell sort of the story of that transformation in New Mexico, very much from both the policy perspective, but also her perspective as a child care director. And so, I think combined, all of these state level examples are the very things or examples of many of the very things that I uplift in the book as states that are doing things right. I think only fair to say, Ellen, I don't think any state has fully cracked the code, right? I mean, I don't think we've got any state that has figured this all out, but all four of these states, I think, really deserve commendation and the attention that we're going to pay to them today when it comes to advancing the ball for kids. So I'm excited to have the chance to talk with them all.
So why don't you all turn your cameras on and we'll begin the discussion. DC, you'll appreciate being called a state. But when Dan and I and Emily and the group from the campaign talked about whom to have on, there were a lot of places around the country that we could have chosen. And we did choose the four of you, but we know that the expertise in the audience is incredible. So if you've got good examples that you would like to share from the audience of how you're addressing this four-legged stool issue that we're talking about today, please put them in the chat, because we want this to be a conversation among all of us, the way the last session was, not just by the people whose screens are lit up here. And so, and we will continue that discussion in the next part after this discussion, when we talk about how do you actually create change that lasts. Let me tell you for a moment why I call this a four-legged stool. There was a leader a while ago, a woman named Gwen Morgan. Some of you may know her or know of her, have known her or known of her. And she, a long time ago, coined the notion of a three-legged stool. And now we have four legs on the stool. So it's, four problems. I can't say that it's standing any better. Her point was that it was pretty tippy as a three-legged stool. But that's why I keep referring to it as that. Let's start with Angela. Angela actually worked in New Mexico for a long time, so I know the enormous effort that it took to get to where you are. I love the fact that you're coming to this as both an owner and as an advocate. And we'd love you to talk about what you're doing in New Mexico in addressing the whole issue of the cost of childcare, but also think about the other issues in that stool as you talk about it. So Angela, if you would just kick off this discussion.
Yes, thank you so much, Ellen. Thank you guys so much for having me. So as you mentioned, New Mexico's been working hard. We've been working hard in early childhood. I'll tell you, this work started long before I ever got into the picture. I'm just happy to be a part of it now. When you're talking about the three-legged stool, right? The biggest thing that always came to our mind was, everything that we needed to address with this three-legged stool, it really always came back to like funding, right? Like it was always, well, that's beautiful, but how? Like, how are we going to pay for that, right? And so I was so excited when my rep, she's actually my rep, Representative Gallegos down here in the South, decided to work with our former Senator, John Arthur Smith, to run a bill to create a trust fund. So New Mexico has an early childhood trust fund, and they set aside $320 million of our surplus in 2021 into this trust fund that was allocated to support prenatal to 5, which some know and don't, but we have a department that we established in 2020 that is a cabinet level department that now serves prenatal to 5. So this funding is going directly to their budget to support prenatal to 5 in New Mexico. That has truly changed the game, right? That has opened up so many possibilities here in New Mexico, and I'll share some of them when we're addressing that 3-legged stool. So when we're talking about cost, we in New Mexico are now serving families at up to 400% of the poverty level. That means a family of 4 can make $120,000 a year and still qualify for free childcare. The last time I looked at the numbers, that was about 80% of the population in New Mexico is now getting free childcare. That has been huge, right? As a provider, I can tell you that has been huge. We no longer are having that cliff effect for families where, as a provider, they've been with me for so many years, mom gets a raise, and now what? Right now what? She has absolutely no support. She's just cut off, right? And so we've seen a significant impact on families when we're looking at providing that extended eligibility here in New Mexico. When again we circle back to the 3-legged stool when we're talking about workforce, I am so excited to say that New Mexico is really trying to tackle that with our funds from the trust fund. So the trust fund is actually, and I love to share this because it is just exceeding our wildest dreams right now. It is projected to be at $10 billion by the 2026. And that is just, more than I think any of us could have ever thought it could be. So we're just really trying to stay strong with making very efficient and intentional policy making and, programs. One of them being our career lattice, our wage and career lattice, right? Where we're focusing on exactly what Dan said, a dog walker not making more than us. And so I'm really excited to say that our pre-K has a community-based pre-K parity program now. So programs like mine are able to hold on to our amazing pre-K teachers, and they're able to make a same wage as they would if they were going into the public schools. So for instance, in my program, you can now make $77,000 with your master's degree and stay in a community-based program like mine. It's definitely, I will say, again, I get that provider side and the advocate side, so I get the advantages of seeing the great work on both sides. And as a provider, I had some of my most amazing teachers that, they had to make a living for their families. So they went and they worked for the public schools. I am so excited to say that a lot of them are back and they're working in my program and they're a part of my school family again. And so these are the programs that have allowed us to make that possible. Trust fund being one of the biggest, I love to say this word because it's never existed, right? The allocated only for early childhood and a sustainable funding stream for early childhood. So it's one of the programs that came out of that. We also are addressing infant and toddler care, right? We know that this is crucial to our children, our families, our economy. So we just recently, this past July, started a pilot program to try to offer the same parity in those classrooms as well. So we're thinking holistically, not just, those 3 and 4-year-olds. We're really trying to ensure that everyone that chooses this career is compensated for doing this amazing work. One of the other things that, we're being very intentional with is, again, access and quality. Our pre-K, so excited to say we are up to, I think the last time I heard 4-year-olds, we're at 90%. So that means almost every 4-year-old in New Mexico has access to free quality pre-K. That is just been exciting and blessing. And I'm even more excited to say that we are very much a mixed delivery model. We have bumps and bruises along the way, right? As everybody starts to work through this and figure it all out. But we have really good knowledge and understanding around best practices and models. And we have a department and a governor and a legislative body that is committed to mixed delivery. And so we were really excited that that's a key component to our delivery model here in New Mexico. One of the best quality measures, we are also, working on ensuring that we're conducting research-based assessments. We're enhancing our coaching. We're creating professional development opportunities. It's now free here in New Mexico to go to school to get an early childhood education degree. Not only is it free, but we offer bonuses. They get support, with books and all of those things. And again, that's on community-based side, and so really supporting programs like mine. So it's just been very exciting. And I think even the most exciting part is our legislative body and our department have been very intentional with including voices like ours from the grassroots. And, I will say that took a lot of knowledge and organizing from the grassroots to get our voices out there and to understand how important those voices are, and how much they're needed. I remember, I haven't been doing this very long. There have been so many people doing this much longer than me. But in the last 7 years, I've been able to be a part of a lot of amazing conversations and a lot of amazing movement here in New Mexico. And I think that has been attributed to really organizing and really making it very understood. When I first started this, someone told me, if you don't make time for change, you're choosing what you have. And I was like, oh man, okay, because I wear all the hats, right? When was I going to go do any of this stuff? But when it was spoken to me like that, and and it was there, a lot of people were making decisions for you without you. And so it's, what does that look like? And so, spreading that word and really organizing from my families to other early childhood providers and educators, and really getting that grassroots organized for these movements has been extremely impactful. And I think we have now been able to put ourselves in a position where we have a department and a legislative body and an executive branch that is supportive and intentional with including us. So I'm just really excited that New Mexico is headed in a great direction. Like I said, has its bumps and bruises. So we're not there yet, but I'm really excited to share all the things that we've been able to accomplish.
And we're going to talk about how you did it. I mean, I love the inspirational message that was given to you to say, yes, if you're choosing what you have, if you don't choose to make a difference and change it. And we're going to talk about how you actually created this pretty amazing change. You saw the hearts coming up and celebration to you. In the chat, I appreciate Brenda putting in what you're doing in Iowa, and also appreciate Nora talking about New Jersey. So keep them coming. Keep the chat coming so that we can get lots of examples, because we're going to build a kind of a registry of all the good things going on. Okay, Chris, you're up next, and you when we talked about this in the pre-session, you talked about not coming at this from a childcare perspective, but coming at this from a health and human services side of and you brought a business perspective to it, which I particularly appreciated, having worked with the business community for a long time. So tell us what happened, what has been happening in North Dakota to address these 4 childcare challenges.
Yeah, again, thank you for having me. I got recruited by Governor Burgum in North Dakota from the private sector to really transform, at that time, the Department of Human Services. And the previous commissioner or executive director at the time just finished her criminal charge, amongst many others, where a child drowned in a swimming pool. And the whole department didn't even want to talk about childcare. And the first time you had to pull a license, the whole place went on lockdown. I mean, no one was excited to talk about childcare. Think about it. Everything in human services, the thing you should be excited about is childcare. I mean, that's your future. That's where you make a difference. But we weren't. So then I learned pretty quickly that I didn't even want to deal with childcare or daycare at the time, and tried to get rid of it and pass it on to the Department of Public Instruction. Failed miserably. And by whatever reason, one of the reasons I got brought on was to create some efficiency and reduce the budget of the Department of Human Services. It then became clear to me, and people can think what they want about North Dakota, but I'll tell you, like, the best thing about North Dakota as it relates to this. Even though I was the commissioner, I got to see families, I got to see kids, I got to see what was happening, and it wasn't a number. It was actually like you did meet families. They had, I mean, felt like everyone had my cell phone. And it became pretty clear that what was going on is there wasn't quality early childhood experiences across the board. Our foster care numbers were high, our behavioral health in schools was poor. And, you know, through both the Aspen Institute having a really great state superintendent in Kirsten Basler, her and an Aspen friend introducing me to Dan, we're putting a plan together. And on August 26th, we went into Governor Burgum's office and gave him a 4-year plan. And it took 2 minutes to convince a Republican governor that childcare was the direction to go. So 2 minutes to convince him, 90 minutes on strategy. And that's
So
really what I
let me
want.
just stop you for a moment. What convinced him?
The data. The data is clear, brain development,
Mhm.
as relates to how a child interacts. It was just purely, when do you make an investment? What is the best return on investment? And to me, this is like, everyone wants a silver bullet for behavioral health, or they want a silver bullet for healthcare spending, or a silver bullet for whatever. There actually is a silver bullet for many of these things, and it's called investment in early childhood experiences, whether that is childcare or whether that is some other, you know, what is ever best for the family. Making the investments in young families so that a child feels safe and loved, so that their brain can develop, so that then they can be ready to go to school. I mean, we are completely upside down. I mean, I think I mentioned this in the pre-meeting, but you know, if you think about it, childcare workers are in the least, elementary school teachers are in the second least, high school teachers are more than elementary, and then we pay these college professors oodles and oodles of dollars just because they sat around and did nothing for 20 years and wrote a paper. You know, I mean, again, no disrespect to people in PhDs who are tenured professors. But that's the truth. I mean, what are we incentivizing? Because we're not getting a return on investment on our higher educational system. I think we all know that. So let's just take a look at where the dollars are spent and where we can get the greatest return. And then, oh, by the way, they are the most vulnerable humans across the board. You know, they're nonverbal, they can't express emotion, they need to feel safe. But we do so much more in nursing homes, and nothing against nursing homes. My point in bringing this up is it's all about mindset. So the other thing that happened is it was really a partnership with Superintendent Basler. Once we decided we were going to do this, I convinced 2 highly influential, very right House and Senate leaders to go to Selma, Alabama. Gina Ross did an amazing job. One of these representatives said, Chris, I'm only going there because I've never been to Alabama. By the time we left, this was his whole focus, because he saw the data. He saw they had been tracking it for so long that Gina could show him how much better those kids in their pre-K program were doing than their counterparts in school, whether it be discipline, whether it be special ed. He's like, aside from that being a great thing, it saves money. So, but it really took 4 years of having to redesign the system in such a way that by the last session, the structure could support the funding going forward. The only thing that bothered me in North Dakota was that we saw the opportunity to tie it towards, we needed workforce, whether that be teachers or nurses or what have you. You know, great, let's make sure mom and dad can go to work. But it still wasn't enough about the child. And I think the more you can communicate clearly that and again, I know it's more than that. I'm the least competent, least experienced person on this call as it relates to early childhood development. But to me, it's just as simple as, if a child feels safe and is loved and has the right stimulus, don't ever use the word curriculum in a red state. It is all about love and safety and caring, that all that matters. And then as we learn more, maybe you can build some curriculum, but we're not even getting the love and safety right.
So what did you actually do? I took you off on how you convinced him, but I'm eager to know what you did. I don't want to get,
Yeah, without going into too much detail, we did start a state-funded, we can't call it preschool or pre-K because that's how dangerous those words were, toxic. We had to call it best in class. And so we took the specific curriculum from that in that first year, along with revamping, because what we had to do first is you had a portion of childcare in human services, a portion in K-12, a portion in commerce, and a portion in the Department of Health. We needed it in one area, and that was, the Head Start teachers, I'll just be clear, we're not too happy. But then from there, showing how the best in class program was working, then we focused on what does a family budget look like, and put together, we changed our childcare subsidies by showing what a family's budget is. We created a public-private partnership, and for those that were above 100% of the state median income, we said, okay, businesses, if you put in $300 a month, the state will put in $300 a month, and then the family is responsible for the rest. The businesses were not happy, so then we put the whole state employee group into that program, and then all of a sudden the businesses followed because they didn't want to lose those workers. The other thing is we had a QRIS system. I'm sure it can be improved, but children in the early that were subsidized childcare could only go to the unrated. So then they could start going to the rated systems. And then we created, in essence, scholarships for workers within childcare to continue their education in early childhood.
okay, that gives us a really good taste with a lot of also advice for how to talk about this in a way that it will be heard. Berna, we're going to move on to Washington, D.C., and you get a lot of attention for your pre-K and other systems to support families. Why don't you tell us about what you've done in D.C. To address these four challenges?
Hi, everyone. It's wonderful to be here. And yes, great things are happening in Washington, D.C., but as Angela said earlier, not without bumps and bruises. We have, of course, Pre-K Enhancement and Expansion Act of 2008, which expanded access to pre-K for approximately 2,000 3- and 4-year-olds. And of course, that number is getting higher. And this was as a result of decades-long efforts with momentum from the Pre-K for All DC campaign in 2006. And following that, the Birth to 3 Act in Washington, D.C., also known as the Birth to 3 for All DC Act of 2018. It was passed by the D.C. City Council and signed into law by the mayor. And essentially, it's creating a comprehensive program to provide early childhood development services and support to infants and toddlers from birth to 3, with a specific focus on expanding access to healthcare, home visiting programs, and subsidized childcare for low-income families. And this was achieved through significant legislative action and advocacy efforts by local organizations and trailblazers that we are blessed to have in DC, because they pushed for this increased investment in early childhood development. And among other things, this particular Birth to 3 Act mandated pay parity between early childhood educators and DC public school teachers with similar roles and credentials. Prior to this, as everyone echoed in a way, early childhood educators with a bachelor's degree earned on average 33% less than their K-8 counterparts. That's a huge number. And related to Birth to 3 Act, Pay Equity Fund was born. It's created to raise early childhood educators' salaries without imposing more financial burdens on families and also early childhood programs, because in DC, it's probably one of the highest tuition rates that we see in the nation. And it was the Pay Equity Fund is funded through a tax increase on high-income residents, particularly earning over $250,000, and it was approved in 2021. So The early childhood programs can opt in. It's not mandatory. They can opt in to receive the funds. And as long as they are operating a facility, in a license and licensed by Office of the State Superintendent of Education, or OSSI, as we say it, and they need to agree to pay eligible early childhood educators by role and credential salaries that meet or exceed the minimum salaries established by OSSI. And of course, there's a application and agreement process, and there are some waivers depending on what the budget is like in each program. It's very specific to each program. To make this work, Early Childhood Educator Equitable Compensation Task Force was established by the fiscal year 2022 Budget Support Act. And the role of the task force is to provide recommendations on how Pay Equity Fund is going to be implemented. And on the task force, I'm also on the task force, and there are educators and early childhood providers, including home and center-based programs, policy experts, higher ed faculty, and advocates. It's a really great, diverse group of stakeholders. And it was implemented in 2 different phases, I will say. So from October 22 to September 2023, the supplemental payments were given directly to the educators, depending on full-time, part-time. It varied, as well as lead teacher or assistant teacher, totaling over $70 million, and each individual received from $5,000 to $14,000. And the payments were, dispersed in lump sum, and then later on FY23 on a quarterly basis. So the phase 2 started in October 2023, and we are still in phase 2. Direct payments are being made to early childhood programs, ensuring that there is this long-term pay parity as mandated by OSSI. Again, it is all about the roles and the credentials of teachers. I want to give examples of dollar amounts. For example, an assistant teacher with a CDA or equivalent, the minimum salary requirement is approximately $51,000. And for a lead teacher with a CDA or equivalent, it's the same amount, $51,000, some change. For home caregiver, this is $54,000. And if you are a lead teacher with bachelor's degree or higher, then the minimum salary for that is a little over $75,000. So this is a significant improvement. And of course, the entire initiative really aims to reduce turnover and attract qualified educators, improve program quality that we are all talking about, because in the end, it is all about the outcomes for children and families in DC. And as of June 2024, the task force reconvened, and we worked on ensuring that there is this sustainability through FY28. And the work of the task force is planned to be completed by February 2025. The recent, from the legislative side of things, September 2024, the task force issued a report recommending updating the minimum salaries for FY25 and the child development facilities payroll funding formula. So we had to tweak some things because we were working with $17 million less than what we needed. So we are working with 70 million again, but we were able to, thanks to all stakeholders' advocacy, save the initiative pretty much, despite the proposed cuts by the mayor at the time from her draft budget. So including healthcare. So part of the Pay Equity Fund is also healthcare for childcare, which is funded as part of the Pay Equity Fund. And this particular piece is providing free health insurance premiums, working with DC Health Inc. for district residents and their families who are employees of OSCE licensed early childhood programs, again, including centers and homes. It also provides free health insurance or lower premiums to non-district residents who are employees of early childhood programs in the district. It helps OSCE licensed, programs provide affordable group health insurance for their employees, again, with help of DC HealthLink Small Business Market. So just last week, Mathematica and DC Action completed a study on the benefits of Pay Equity Fund and shared the report, which was absolutely eye-opening. And I want to highlight one piece because it's a very lengthy report, of course, but the return on investment from the Pay Equity Fund is 23%.
Wow.
Huge, huge return on investment. Of course, we are looking at educators and child development programs and families. So for educators, the report is showing that we have fewer absences from work, and we're able to hire teachers with more work experience. And also, this is for most people, most educators, it's the first time they actually have healthcare at this level. And also it is helping them to reduce their medical debts.
I think what's so wonderful is that you've included not just salary, but healthcare. I want to, is it okay to move on to Martha now?
Sure.
Okay, so Martha, what you're doing in South Carolina has been very touted. We'd love to hear how you're addressing these 4 challenges.
Well, I certainly want to hear more from New Mexico and DC as to how they got that teacher parity. That's big on our list. But in South Carolina, the mixed delivery 4-year-old kindergarten program that we support came about from actually a court case where school districts in South Carolina got together and sued the state of South Carolina, saying the funding model was inequitable, which indeed it was, and indeed it still is. It did not change anything, the lawsuit about 20 years ago. But what did change, what came out of that lawsuit, was the judge ruled that indeed children in South Carolina were coming to school with who were Medicaid eligible, were coming with far less equitable challenges and resources in their lives. So our program was created, which is called Child Early Reading Development Education Fund, SERDEP, which is not a thing, but it's just the acronym for our program, SERDEP, State Funded 4K. But the novel thing was that it was created as a mixed delivery system, funding both public schools and in them the private side. About 90% of our programs on the private side are licensed childcare, but we also do fund charter schools and nonprofit independent schools. What we've really worked hard to do as a team, first of all, was to build a great team statewide that could provide support to independent, mostly mom and pop childcare, who did not have the resources for training and professional development and curriculum and materials. And, in order to have strong classrooms, you've got to have wonderful materials where teachers not only know how to interact with the children and teach them how to interact with the materials, engaging classrooms. That was strong in our bucket list. So we have 19 coaches that work across the state who actually do support in our classrooms individually. So we want to get right down, boots on the ground, and make sure that our programs do receive that high level of professional development. We also do some statewide trainings, and we call them our academies, where childcare teachers, it was the very first year we did this, it was just, it would have it brought all of us to tears to see these teachers truly treated as professionals, coming together with national presenters, childcare teachers who had not ever been really addressed as childcare teachers before. And that feeling went back. We also, our leaders, we want to support the leaders, because if, not only do our childcare center directors need to know about making sure they have healthy meals and that the commodes all work every day, but they really are the instructional leader of that school and that program. So we want to make sure that they're involved and that they understand and support everything that happens in our 4K classrooms. We feel like if everybody in our program does not have this sense of urgency in helping our families to understand there is not a day that can be wasted in the life of a 4-year-old, not a day. And that is something that I think our entire team really helps to just involve that throughout our program. We all share that same vision of making sure that families have what they need. And then the rest of the programs, the 0 through 3s, also jump in. Another great novel thing that we've done in South Carolina, I believe, is our DSS, Department of Social Services, who has South Carolina Child Care Scholarships, as well as our QRIS system. We partnered with them so that every child that is approved as a First Steps 4K student, automatically their siblings get a full-time 0 to 3, they get a full-time scholarship. And 4-year-olds through 12-year-olds get a half-time scholarship and aftercare. So it's full family, 52 weeks, no cost at all if a child is approved for First Steps 4K. Bring the whole family. We want you all. So that has been a game changer in South Carolina, to be able to see families, that reap the benefits of being involved with First Steps 4K. Getting these higher salaries, though, our teachers are employees of the districts of the centers where they work. And so when I hear your stories from New Mexico and DC, it just enthuses me to go back and, Yahoo, let's do this big goal. Yes, let's see what we can do to help supplement these salaries for our teachers, and I think we would all agree, money is not the only thing that brings you to a job or keeps you in a job. That intrinsic desire and that intrinsic feeling that you really are making a difference. And that's where I think First Steps 4K really shines. Our coaches, our managers, we have an amazing engagement coordinator who works with families, even our team at the office, the enrollment coordinators, they all make sure that families understand that they're first, that we want the families. That's what we're there for. That's what it's all about. And it is not, we do know you have to have money and you have to make money to be able to live. And certainly in our society, that salary does show respect. And we want our teachers to feel that high level of respect. But we also know that many other things go along with that salary, job satisfaction. You hear many teachers that leave the profession every day because they are not receiving that support and that desire to continue on in the profession. So we hope in South Carolina that we not only are continue to do some great things, but that we listen to the lessons of our neighbors in all 50 states, and that we can all learn together to share for families what we know.
What's so amazing about each of your stories and all of your stories together is that how it gives us an opportunity to learn from each other. So each of you is addressing 1 or 2 or 3 parts of a big puzzle as we try to take that whole child, whole family, whole system kind of approach. But by coming together, we're learning how to do this. I know, just want to tell you about something that I'm doing before we launch into how you all made this change, because that's a big thing that the participants wanted to hear. Is I've been working with the National Head Start Association in looking at the comment, Bridget, about Maslow's hierarchy of needs triggered me to tell you all this, which is that we've been working together to create a thriving workforce index where we're serving teachers, the teaching staff and Head Start, the whole staff and Head Start, the bus drivers, the secretaries, everyone who works in a program, about the workplace environment, because it's salaries that and benefits in healthcare, but it's also how we treat each other. And then we're working with them to come up with ways to improve their working environment that can create a better place for them to work. Because if we don't have caring environments for adults, we won't have caring environments and learning environments for kids. I want to now, you've thrown in a lot of, so if you want to know more about this, I'll put my email into the chat so that you can ask us about the Thriving Workplace Index. But we've heard from a lot of you about some of the from each of you about some of the tactics that you've used. Chris talking about how you made the case with data about brain development and that we can't waste a day, and some of the messages that you use. So I'd like to go to each of you, including Dan. So we'll just keep doing round robin, because what I want to end up, and I want everyone on the call to put in your strategies for creating change that sticks too, because out of this, we will create a list of what we can do to bring about change. So let's see, let's start, we'll start with you, Angela. What advice would you give to your colleagues on the call about how you create change in your state, in your community, in your system?
Yeah, I think, the chat, by the way, I'm trying to pay attention and do my job here, but it's like really hard. There's so much good conversation happening there.
It is. It's great.
I don't know. I was like, I'm multitasking. No, but I think a lot of that conversation in the chat is part of it, right? And one of the things I always say is, start local, start small. You don't realize that it can turn into something so big, because I promise you, when I started this, never in my whole entire life did I think I would be sitting in a space like this. I started having conversations about, at that time, I'll be honest, what got me into this is something, a bill, mind you, no political anything at that time, didn't even know what a bill was. Somebody told me that they were going to take all my 3- and 4-year-old kids out of my program and put them into the public schools, and they were no longer going to be able to stay in our programs. My families actually came to me and said, Miss Angela, am I going to have to pull the baby? Like, what's going on? Right? I'm like, I don't know. What are you talking about? So again, it doesn't have to be your background even to be in these spaces. I always say, start small, start local, have those conversations. I had at that time, we had conversations with families, other educators, other providers. We ended up organizing a space where those voices felt heard and needed. And once we did that, the conversations weren't able to be ignored anymore, right? We were in those spaces, and we were having these important conversations, and we were educating in these important ways from the people that it was impacting the most. And I will tell you, that particular bill was a very highly favorable and a very highly funded, I found out later, bill that never got heard. It never got heard in that session, because we ended up going up there with probably over 100 families and educators and providers from the South, which I don't know if you know most about New Mexico, but our bigger cities are a little bit more up in the northern area and the mid area. So, it was even unheard of for us to drive the 4 hours to go do this, right? So again, I just tell you, it's to me, it's just start the conversation. Start the conversation with the people that are doing it. Your voice does matter. And when you start exercising your voice, it does get heard.
That's so be the change that you want to see in the world, and start with yourself, and then widen the circle. Let's go on. Let's see. I'll go to Berna next. One piece of advice for bringing about change.
So yes, if I can think of one thing, that would be collaboration. And it's business leaders, community organizations, advocates and organizers and families, funders, everyone needs to be holding each other's hands. Education is another piece that was very, very important for us in DC. So as DCAUIC, we are part of the Under 3 DC Coalition. And we are, organizing and activating our members, educating everyone, educating ourselves through, teach-ins and Q&A sessions, small group meetings. And sometimes we need to do, individual phone calls. Hey, are you coming to this meeting? And I have to say, NAEYC's public policy forum, that's generally in February, that is incredibly helpful because there is so much to learn from all around the nation. And you get to talk and see what's happening. What are some of the, things, just like we are doing right now, learning from each other and being bold. So being shy and staying sort of, at the background is really not helpful. We have to see who is, out there and who are the trailblazers. What can we learn from them? And also every single person, assistant teacher, family member, whoever you are, you definitely have something to offer and it's invaluable. Being out there in terms of testifying in public hearings or during the budget season, telling your stories. One thing I learned is stories are very powerful. I'll end that with that.
Stories are, I love that. Stories are powerful, and hold hands and with everyone and go together. Okay, we're going to go up to Martha, and come on, the 221 people who are listening here. You put your ideas in the chat. We want to hear from all of you. This is a collaborative list we're making. But let's Martha next. Oops, Martha, you're on echo. It's echoing. Echoing. So maybe you can figure it out. I'll jump over to Chris for a moment, and then maybe you'll work on the sound. Chris.
Yeah, I think just being the contrarian that I am, maybe put it even a different spin on your four-legged stool as it relates to this.
Mm-hmm.
You see a lot of workforce recruitment and retention strategies in K-12 and healthcare and in other areas. And I think, the way, you need to speak up, and everybody has probably 10x the passion and emotion for this work than they even do the intelligence. And I'm not trying to reduce that. But when you come into especially red states where it's give us money, it sometimes gets lost as it's, for lack of a better word, I don't mean this in a bad way, even though it's like whining. Come in and take it from the standpoint, we are professionals. We can show you, if you do this, this, and this, you can expect to get this. Nothing about, and I've seen some things in the chat about, what if K-12 does it? What's going to happen to home daycares? I think as much passion as there is across this whole group, I think there's, at least in some areas, like some passion on certain types of childcare. And I think it's just so important that you just get to the basics and educate the legislator and walk them backwards to what problem are you trying to solve? And then the problem that you're trying to solve, whether it be anything in K-12, anything in corrections, anything in foster care, anything that has to do with usually your biggest budget, we can help you reduce it if you make investments here and you make it available. And then once you make it available, that is when the industry gets propped up, gets more respect. And then with that respect just continues to grow. In some ways, if things go the way I think we all hope they do, in 2 generations, we could be raising early childhood up as high as, I don't know, maybe higher ed, and maybe higher ed will come down. Not that I got a thing with higher ed.
The higher ed people are gonna, this is not against higher ed, this is for childcare. But what I think you're saying that is so important is perspective taking. That is, know your audience. Don't really understand what moves them. What is in the work that I used to do with the business community, we'd call it the business case. Make the business case, which is what's the reason for investing? Dan, I'm going to jump to you, and then maybe we'll go back to Martha and see if we got the sound fixed.
Yeah, have been really interested in the conversation. I maybe want to extend a little bit on what you and Chris have just been saying, because the piece of advice that I would offer is very similar, which is that we have to become really masterful at matching our messages with the audience in question, and increasingly have an ability to do that almost on a policy maker by policy maker sort of basis. One of the reasons that I wanted to put the book down in writing was to make as broad an array of cases for early childhood investment as possible, to really spell out the bipartisan case, because in my experience working in the States across many years now, there is a message and a reason for just about everyone to get excited about investment in young children. There is a case that resonates with just about every policymaker, just about every voter, no matter where they might stand on the political spectrum. That there, for fiscal conservatives, for example, there is a very powerful economic case for doing this. For social conservatives, there is a very powerful family strengthening message, and the list goes on and on and on. What I have found, though, over time is that we as early childhood people tend to lead with the kind of warm and fuzziest messages that that this is good for kids and that this is good for brain development, and that's absolutely the case. That, I have learned, is not the most convincing argument in some cases for some policymakers. And so, I think the key, in part, there was a question, I don't recall if it was in the chat or in the Q&A, but about sort of like, how do we approach this, and how do we champion this in states that may not be as hospitable toward these investments? And I think the answer very much is analyzing who you need to make the case to, finding out what they care most about. Chris mentioned the criminal justice system, for example, that that there is an amazing case that these investments help to minimize criminal justice interactions. There is a case that it helps to minimize long-term dependence on social services. There is a case that these investments improve long-term health outcomes, which I know Chris maybe more than others will appreciate. As we go around the country, states are spending a huge amount, if not the majority, of many state budgets on their investment in Medicaid, for example. And so, knowing how to make the argument to the right people and connecting it to the right message, I think can be really transformative.
Different messages for different folks. But when I was writing the breakthrough years, one teenager said, I think it very well, which is listen first before you talk. And then when you talk, listen with the perspective of the other person in mind, not just your own perspective, which I thought was fabulous parenting and advocacy advice.
Absolutely.
Martha, do we have your sound?
How's that?
Perfect. Yay.
Yeah, awesome. Good. Well, I was just going to chime in about the how one voice is so important. And we often forget that with our legislators, to make sure that they are, our governor's office and legislature, that they hear you. But workforce development is another thing to make sure to remind them about, that if we don't have childcare, there will be no workforce, and high quality childcare at that. We need to continue to talk about that. I wanted to mention too that our program, we are funded by the legislature for 220 school days and not 180. We know that summer slump is real. Families don't have childcare often in the summer. And if you could continue this same educational program throughout the summer, that's a great benefit. 8 hours a day and also 220 days a year. So just a little niblets of ideas to the legislature and the governor's office. I believe that it sounds like all four of us that we come from states where we do have that strong support, both sides of the aisle, and the governor's office understanding what it takes. But family, that voice of a parent, cannot ever be understated enough. one parent speaking with a legislator can change everything when they really understand the value of a child care home. And if you take 4-year-olds out of childcare for the entire state, you are going to decimate childcare. There will be no childcare system. So lots of messages that really are simple, but they're huge messages that we should continue to make sure that we use our voice and pass it on.
So I'm gonna now end with, before we get to questions and answers, with 8 lessons that I've heard over the years for bringing about change that sticks. One is it takes time and a well-developed network of partners to bring about change, that you need to understand the issue before you take action. How do people see and think about it? Don't take action before you understand who your audience is. Know what the ask is, because if you're just trying to educate but you don't know what you want to happen, that doesn't particularly help. Lesson 4 is that messages are critical. Unexpected messages have stopping power. Brain development was an unexpected message in its time. These messages must evoke feeling. It's not just intellectual. It's not just a cost benefit, but that's why the parent is so effective, as you said, Martha. Asset-based messages are important. If you have emotional messages, back them by rational messages. Take on problems that can be solved. So that's lesson number 4. Lesson 5, unexpected messengers make people pay attention. People that you wouldn't expect to be talking, a business leader or, the police or, other people that you wouldn't expect. Target the people who have the power to bring about change, recognize, connect, and assist them, and then be prepared to take care of opportunities. That's number 7, as they arise. And then I think you said this Berna, but make sure that you're detailing the outcomes, success, pay attention to your results so that you can prove to people that what you're doing is making a difference, and also so that you can improve what you're doing, because it's all going to have the bumps in the road that you were all talking about. Okay, now I'm going to go to questions, and Emily's going to assist me here. I see that we have
Quite a few.
Okay, go ahead, Emily.
So yeah, there's actually some good questions, and I don't think we've really touched on this too much, but it's funny. The GLR team just had a great call with folks from the National Association for Family Childcare. So if you didn't know that exists, it exists. But how do home-based childcare providers fit into these strategies that are supported by the state? So if you all could respond to that.
Anyone who would like to respond?
So I work directly with home providers as well. So full circle, we actually have currently we have a mentorship program supporting home providers to go from registered to licensed and then onto our accreditation system. We support them with both their quality and also their business side, right? Really making sure that they're feeling good and confident in that space. In that opportunity, I have been able to create a lot of relationships with home providers that has allowed me to hear some of the things that were shared. And I think the biggest thing for us, we do here still count everybody under community-based. That is still the umbrella that everybody falls in, but we're very intentional when we're having conversations to say, okay, that works for centers, but does that work for homes, right? Or we're very intentional with saying, okay, as long as they are licensed through the department, they qualify for these programs, they qualify for parity, they qualify for the childcare assistance, right? So making sure that we are being very holistic and intentional, but that did take bringing home providers into that space, which I know is a lot more difficult, right? I have an amazing staff that creates opportunity for me to walk away every once in a while. They are all of the things all day long. So I know it is a little bit more challenging. That's why we are excited to support them.
Other people who would like to answer. I mean, I think when you talked about holding hands with everyone, it means everyone. And if we talk about treating people as professionals, it means everyone. I once did a wonderful study of equality in both unlicensed and licensed in friend and neighbor care, as well as relative care, and quality varied among them all. You know, licensing wasn't the only solution for quality. We found that intentional providers were the best, but I think building a whole community is really important. Other people about involving family child care providers? Other people
Also,
have?
if there's
would like-
strategies for how they can actually access funding for their, go ahead, Berna.
No, I was just going to say, I mean, we really are not looking at home-based early childhood programs in any different than, you know, center-based, because we have to remember that home-based providers, for lack of a better word at this point, they chose to be working with children in a home setting. And families also choose to send their children to that setting. It doesn't make it any different. You know, we can never say early childhood education centers are higher quality or they have more credentialed, you know, teachers or directors. That's just not how we are working, and that's not our reality. It's a choice, and that's why we always say we are promoting and supporting mixed delivery system, because I personally believe that families should have a choice, just like teachers should have a choice as to where they want to work. Or as a business owner, I should have a choice what kind of business I'm going to have, what's the model. So yes, we are all part of these conversations, and we are truly partners, and this is intentional.
Okay, let's go to another question.
Well, I mean, flipping it, there's also been a couple questions about the relationship between early child care providers and, you know, the sort of pre-K-12 public schools, and the sort of like, you know, first of all, how does pre-K-3, pre-K-4 affect those that are trying to provide, you know, early child care for those ages? I mean, does it affect them? And then in general, like how can we better sort of the relationships and the understanding of these two, you know, different but equally important and needing to be reciprocal institutions, networks?
Well, if I could jump in quick, I think this was one of the things we did, and it turned some light bulbs on for some legislators, because we said 0 to 3, you lose money. 4 to 5, you make a little money. And if you do an after school program, you can make a whole lot of money. And so they're like, well, why is that? So that was used, frankly, that was used as the way to say, okay, the business model is broken. What are we going to do to fix the business model? So I think there's this idea that schools are trying to sneak in and try to quote unquote steal the market, maybe. I think they're trying to solve a problem, but they know they can't solve the problem of 0 to 3. And I think the schools that figure that out are going to be another option in the market for parents. But I just don't think they're there yet. And I don't think there needs to be more collaboration between the licensing agencies and the schools in how to get that done, because they don't want to go through 2 license reviews every year. And I think everyone has to come together and figure that out.
It's also the kids. I mean, if we have the system all in silos, it feels silo-y to us, but it feels the transitions for kids from one system to the other also feels like, you know, jumping across a chasm sometimes. I love some of the comments in the chat with what Connecticut is doing. Jan, your comments are also wonderful. So we'll collect all of these and send you all back. Some of you will organize the strategies that work. Let's see if we have time for another question.
Yeah, I just want to also say the GLR team is very committed for both the October 1st session and this session, because you all have been, because Ellen's been asking for, and you've been responding with your great ideas in the chat. We're going to find, you know, you probably have all have experience with Zoom where you first download it and it's like a big mess. So we're going to get them organized and get those back out to you all in our follow-up email. And also, as you are seeing, we just posted our feedback poll. And as I mentioned at the beginning, like we took comments directly from the feedback poll from October to think about how to frame this session. So we take your ideas very seriously. So please take a few minutes, you know, while we're continuing the conversation.
Ellen and Emily, before we
Yeah.
jump onto a new question, can I make one point quickly
Of
about
course. Yes,
this mixed delivery system? It's a place that I really want to uplift South Carolina
Mhm.
in an important way, because I think it is important to say that system structures, state structures really matter. We've talked a lot about mixed delivery, and the reason that we need mixed delivery systems in large part, as Chris mentioned, is that there is a business model in the childcare industry that just doesn't work, and there is a really existential threat to the childcare landscape if public schools come in and play too big a role in state systems. And so I think it, important to say, and Martha, weigh in here as well, but one of the things that I think is really noteworthy about South Carolina that I highlighted in the book is that the structure is very different. Lots of states claim to have mixed delivery systems, but frequently what that looks like is that the money goes to the public schools, and then it's up to the school districts themselves to decide whether the private sector providers participate, how they participate, and which of those community-based providers have the opportunity to participate. And in politics, there's the term rhino, right? That Republican in name only. I call this mino, right? This is mixed in name only. Whereas South Carolina has created this very unique structure, right? So we know that there is participation from the public schools. The South Carolina Department of Education oversees dollars directly to the state's public schools. But Martha's agency, First Steps, has a separate allocation that is only for use by community-based providers. And there is an infrastructure that has been created within First Steps, as Martha has detailed so beautifully, that is there to support the participation of those community-based providers. And so I think it is I uplifted in the book it as a model system in the sense that it is one of the states, if not maybe the most prominent state, in which if you are a community-based provider, you have a real meaningful opportunity to participate. It's not up to any sort of gatekeeper, within the school district settings to decide. There's a dedicated funding stream that is only for their participation, and I think that matters a ton.
Martha, before you go, I just wanted to jump in. So, because Martha Ray, another Martha in our audience, asked exactly the question that Dan kind of just answered, but I'd love to still hear from Martha Strickland. What steps did South Carolina take to strengthen early childcare systems partners? Her state has underinvested in systems building, given priority to LEAs, and small community-based programs are struggling even more. I mean, Dan just talked about this. How do we turn this around? So exactly what Dan was just talking about, but yeah, Martha, tell us.
And I think a lot of this, we are a very strong choice state in South Carolina, but a lot of this came from the infrastructure of our childcare providers themselves, an outcry from them to understand, like, you cannot take 4-year-olds out of childcare. You're going to ruin the state. Childcare will not exist anymore. But it is, as Dan said, we have our separate budget, our separate funding stream, and we provide the professional development and determine those needs on our side, which might look very different than a public school system would look. So we are given that flexibility to design the program so that it really does suit. And the majority of our providers are single owner, we call them mom and pop childcare centers. That's the majority of our providers that are able to participate with us because their voice matters just as much as everybody else's does. And we want to make sure that they receive what they need. And we rely on them. They are our partners.
I think what you've just said, Martha, speaks to the importance of leadership too, and how crucial it is that leaders understand these issues from a whole system kind of approach, or are really super smart like Chris and can figure it out. And sometimes the outsider view brings a whole new perspective. But the leadership that each of you, all 5 of you who are with me on this, is just phenomenal, I think, in moving toward a different system. Roxanne, thank you for summarizing what we need to do. next. She gave us all to do lessons from this, which I think are wonderful. And I wanted to also tell you that for the last 4 years, I've been working with the school superintendent organization on an early learning cohort where we are educating, if that's the right word, working with school systems, with district leaders, superintendents, to understand the early learning systems so that we can support a whole system kind of an approach that contains many of the lessons that you all are talking about today. I wondered if each of you wants to give, we have 2 minutes, some closing comments. I'm going to come to you, Dan, last, but I'll start with Angela. Just any closing thoughts that you have for all the wonderful people who on.
I want you to say whatever you want to say, but there was also a lot of questions about the fact that we're moving into a Trump administration, that there are states that are considered not child friendly. Chris touched on this a little bit, but if you want that, if you could make that part of your closing comments, what are your advice? What's your advice in the administration we're rolling into, and that framing it that way, but say whatever you want to say.
Great, thank you, Emily.
No, with what Emily said, I think Chris touched on it a little bit. My biggest takeaway when working across the aisle and being very bipartisan, I only do this for kids, right? I don't have a political affiliation at all. My biggest takeaway is the language we choose to use.
Yep.
I think it is so important to be mindful of the language that we're using and who we're using it with. You go into certain spaces using certain words and you will immediately be shut out. It's not because you don't have a great message, and it's not even because they won't agree with you, because I found that when I've changed my language, all too often they do actually care, and they do entertain the conversation. But it is very important to be mindful of your language. I would even, look up there's been different reports about, language and things that can be used in different spaces by a lot of great organizations, but language is what I would say.
And that's
Angela, give us an example. Chris said, don't use the word curriculum. Give us an example. At least warm up to the word curriculum.
Yep, don't say equity.
It's a very triggering word for a lot of people. Again, I think it's just a lot of word choices. I think when you stick to what it is, when we stick to it being about children and about the fact that every child in this state deserves their best start, every child in this country deserves their best start, and we can all think of that differently, but we agree with that. I truly believe that. And when you just go into a conversation focused on that, I think they often open up about their perspective, and it allows for dialogue.
Mm-hmm. As Bridget said, code switching can be hard too. Okay, let's go to Berna. One takeaway.
I will say informing, organizing, and activating our collective power, because we do have power, and we need to focus on solutions.
Great. Okay, Martha.
Again, I think every voice being heard, really realizing that each individual person does have power, and that you can reach out to your own legislators, whether you're talking with legislators on both sides of the Senate, the House, the governor's office, but your personal legislator, when you're a constituent, it makes a difference, I think, to them. So don't forget your personal power.
And as someone said in the chat, remember they need to get reelected. So yes. There's a business case there, Chris.
Yeah, I just want to double down, I think was what Angela said. And I think even for all of us, and I'm not a good teacher because I already say blunt things to try to divide higher ed from childcare, but I think, no one is probably better than you in meeting people where they're at. So, you're able to do it as high quality early childhood educators. You can do that with legislators, and you need to meet them where they're at and what problem, I mentioned this, what problem are they trying to solve? And they will absolutely love you for that. I think because again, I didn't do child welfare, but if you can accept that every parent wants the best for their kid, even if they are not taking care of that child, as soon as you can accept that, you can build a better system. As soon as you can accept both the right and the left want quality early childhood experiences, you'll be able to build a better health or childcare system. So that'd be my thought.
I love that. And it's, we used to say that you don't see the light until you feel the heat. So help people solve the problems that they face. Dan?
Ellen, I hope that this conversation actually gives people a lot of hope themselves for the next couple of years. You know, I started the conversation. I certainly detail in the book the way that that this is a topic on which there is tremendous leadership in states both red and blue, and you see that on the panel today. You've heard it throughout the conversation. If there is anything that we should be able to agree on a bipartisan basis, it is absolutely meeting the needs of young children and families. And so I am the eternal optimist when it comes to our path forward here.
So Bridget just asked if there's going to be a part 3, and there's not exactly a part 3, but I just want to highlight that December 17th, we are going to have a session, a little bit reflecting on some of the comments that Dan made and Chris about the impact of profit-seeking investments in early childcare. And we're going to have, folks representing the big companies, the, Bright Horizons, KinderCare, and folks representing the smaller, as you guys said, mom and pop, as well as national sort of people who are keeping their eye on all this stuff from the organizations that you all know. So that's December 17th. I just posted in the chat the links to register for our upcoming webinars, but we're already way over time. We could probably keep talking all night and into the Thanksgiving holiday. But thank you, Ellen. You're such a brilliant moderator. Thank you, thank you, thank you. We're so lucky to have you. All of you. Dan, so glad to have you back. Chris, Martha, Berna, Angela, we are so grateful to you. Thank you for sharing the great work in your states and the District of Columbia. I live there too, so I get it. Thank you to all of you, and thank you to everybody who's participating. Excellent comments, and like we said, we are going to clean up the chat and make sure it's available to all of you to review. So thank you to everybody, and have a wonderful evening.
Happy Thanksgiving, everybody.
You all.
Happy Thanksgiving.
Happy holidays.